Taking good care of your liver is super important for staying healthy, but it's something a lot of us don't think about much until there's a big problem. The liver is like a powerhouse inside your body. It's the biggest organ inside you and does loads of important stuff. It helps break down the food you eat, gets rid of bad stuff in your blood, helps you digest, and keeps your metabolism running smoothly. This means it's not just about your stomach feeling good, it also helps you fight off sickness, keeps your hormones in check, and gives you energy. But here's the thing, your liver can get in trouble if you're not careful. Drinking too much alcohol, eating junk food, being overweight, catching certain viruses, or being around harmful chemicals can all mess it up. The good news is, if you catch problems early and start taking better care of your liver, it can heal itself pretty well. Keeping your liver healthy is about more than avoiding sickness, it's about feeling good, having energy, and being healthy all over. So, knowing how to look after your liver and spotting the signs that it might not be happy are key to keeping this crucial organ working right and keeping you feeling your best. This video is all about teaching you how to spot the early warning signs that your liver might be in trouble. We want to make sure you've got the information you need to catch these signs early. Catching them early means you can get help sooner, which might let you fix the problem before it gets really serious. We're here to help you get smart about your liver health, so you can take charge and make smart choices to stay healthy. Knowing what to look out for is super important for stopping bigger liver problems down the road and keeping yourself feeling great. Number 1. Changes in skin color. Seeing changes in the color of your skin can actually tell you a lot about your liver's health. For example, if your skin or the whites of your eyes start turning yellow, it might mean you have jaundice. This happens when your liver can't properly get rid of bilirubin. Bilirubin is something your body makes and it breaks down old red blood cells. If it builds up, you start to look yellow. This yellowing isn't just a small issue, it could be a sign that there's something wrong with your liver or that there's a blockage in the bile ducts, which are part of the liver's system for processing waste. Noticing your skin's changing color is really important because it's like your body's way of waving a flag and saying, something's not right here. That's your cue to get checked out by a doctor, so you can figure out what's going on with your liver and get it sorted out before it gets worse. Number 2. Abdominal pain and swelling. Feeling pain and swelling around your belly, especially where your liver sits up on the right side, could be a red flag for liver trouble. This can happen when the liver gets inflamed, a situation often called hepatitis, making it bigger and pushing against other parts of your body, causing discomfort. Swelling in your belly might also mean there's too much fluid hanging around in there, a problem known as ascites. This is something you see with liver cirrhosis, a serious liver condition. Both of these signs, pain and swelling, are big deals, hinting at serious liver issues. They mean you should get medical help fast to figure out what's going on and how to deal with it. Number 3. Chronic fatigue. Feeling constantly tired, a kind of tiredness that doesn't go away even after you rest, can be a sign your liver is having a hard time. This isn't about being a bit tired after a long day, it's a deep, ongoing exhaustion that makes even simple tasks feel too hard. This happens because if your liver isn't working right, it can't get rid of toxins well, and they start to build up, leaving you feeling wiped out all the time. This level of fatigue can really mess with your day-to-day life, and it's a hint that your liver needs some attention from a doctor to figure out what's going wrong and how to fix it. Number 4. Nausea or vomiting. Feeling sick to your stomach or throwing up can be signs your liver isn't doing its job right. This can happen because the liver can't clean your blood well, letting toxins build up and mess with your stomach. Problems with your liver can also throw off the balance of digestive juices and bile, making you feel even worse, especially after eating greasy food. These symptoms could point to several liver issues, like hepatitis, fatty liver disease, or cirrhosis, making it really important to talk to a doctor to figure out what's going on and how to treat it. Number 5. Loss of appetite. Not feeling hungry can be a red flag for liver problems. It happens when your liver isn't as good at dealing with nutrients and toxins, messing with how your body handles food and digestion. Liver diseases can mess with your metabolism and change how certain hormones work, making you not want to eat. Feeling sick, having pain, and being super tired from liver issues can make this worse. If you don't feel like eating for a long time, it can lead to losing weight and not getting enough nutrients, which is why it's important to get your liver checked out. Number 6. Dark urine color. When your pee turns a dark color, it's often telling you there's a liver problem. Normally, pee is light yellow to amber, depending on how much water you drink. But if your liver's having a hard time, it might not handle bilirubin right. Bilirubin is what's left when red blood cells break down, and it should go out with your poop. If it ends up in your pee instead, things can look darker. This could point to a few liver issues, like hepatitis, cirrhosis, or blockages in the bile ducts. Number 7. Pale stool color or bloody. Seeing stools that are pale or even clay-colored, and finding blood in your stool, are big warning signs of liver trouble. Normally, stool is brown because of bile, a fluid your liver makes to help digest fats. If your liver's damaged or something's blocking the bile from getting to your intestines, your stools might turn pale because they're missing bile. On the flip side, bloody stools might mean there's a serious liver disease at play, like cirrhosis, which can cause bleeding inside your digestive tract. Both of these signs, pale stools and blood in your stool, are urgent reasons to see a doctor. They can point to everything from blocked bile ducts to severe liver disease, and finding out what's wrong sooner rather than later is crucial. Number 8. Tar-colored stool. When your stool looks black and sticky, like tar, and smells bad, it's called melena. This happens because of bleeding in the upper part of your gut, like your stomach or the start of your small intestine. Blood changes as it moves through your intestines, mixing with enzymes and turning your stool this dark, tarry color. Melena can point to serious liver issues, like cirrhosis or hepatitis, which can cause bleeding veins in your esophagus or stomach. It could also mean other serious conditions, so seeing a doctor right away is crucial. This symptom shows how vital the liver is in handling our blood and digestive health, emphasizing the urgency of addressing any liver damage or disease. Number 9. Itchy skin. Feeling itchy all over, without any rash, might be a clue that your liver isn't working right. This kind of itchiness, more intense than what you'd get from a regular skin issue, can happen when your liver is damaged and can't get rid of toxins properly. These toxins build up and irritate your skin. It's especially noticeable on your hands and feet, and it can get worse at night. Conditions like primary biliary cholangitis, primary sclerosing cholangitis, and hepatitis could be the culprits. Number 10. Tendency to bruise easily. Bruising easily can be a key indicator of liver trouble. The liver makes proteins that help our blood clot, so when it's not working right, we might bruise from even small injuries. This often happens with liver issues like cirrhosis, hepatitis, or fibrosis. Other signs like bleeding gums, nosebleeds, or spider-like blood vessels on the skin might show up too. Number 11. Swelling in the legs and ankles. Having swollen legs and ankles, known as peripheral edema, can be a sign of serious liver disease, like cirrhosis. When the liver's damaged, it can't make enough of a protein called albumin that keeps fluid from leaking out of our blood vessels. So, fluid ends up pooling in our legs and ankles instead. Liver problems can also increase pressure in a major vein, making the swelling worse. This issue tends to get more noticeable after standing or sitting for a long time, and can come with other liver disease signs like belly swelling, yellow skin, and feeling really tired. Swollen legs and ankles mean the liver needs a checkup to tackle the root problem and keep things from getting worse. Number 12. Weight loss. Losing weight without trying can be alarming if you have liver disease. It means your liver isn't managing nutrients and digestion well anymore, leading to not getting enough nutrition and even losing muscle. This can happen with serious liver conditions like cirrhosis, hepatitis, or cancer, even if you're eating the same or more. You might also feel weak, tired, and not hungry, making things worse. Number 13. Weakness and muscle wasting. Feeling weak and losing muscle, especially with liver disease, means the liver isn't handling proteins and nutrients correctly. This can lead to muscle loss or sarcopenia, common in severe liver issues like cirrhosis. the liver might not make enough proteins to keep muscles strong, and not absorbing nutrients well makes it worse. This affects daily life and raises the risk of falls. Treating this involves dealing with the liver disease, eating better, and sometimes physical therapy to build strength. Number 14, confusion. Getting confused can be a sign of a serious liver problem called hepatic encephalopathy, where the liver can't clear toxins, affecting the brain. It can lead to mild forgetfulness, severe confusion, and even coma. This shows how vital the liver is for brain health. Treating it means tackling the liver issue, changing the diet, and using medicines to lower toxin levels. Number 15, drowsiness and slurred speech. Feeling very sleepy and having trouble speaking clearly can point to hepatic encephalopathy when you have liver disease. These signs mean the liver can't get rid of toxins well, leading to serious brain function issues. It shows up as needing more sleep and having problems talking properly because brain signals are messed up. If this happens, it's very urgent to see a doctor because it could get worse quickly. Treatment aims to lower toxin levels, often with diet, medicines, and sometimes procedures to help the liver. Number 16, yellowing of the skin and eyes. Seeing your skin and eyes turn yellow is a clear sign of liver trouble, known as jaundice. This happens when bilirubin, a yellow substance from breaking down red blood cells, piles up because the liver can't process it out. Jaundice can point to serious liver issues like hepatitis, cirrhosis, blockages in the bile ducts, or even liver cancer. It can also mean problems with the gallbladder or pancreas. Number 17, fluid retention. Fluid retention in liver disease, like cirrhosis, often leads to ascites and peripheral edema. Ascites is fluid buildup in the abdomen due to portal hypertension, which occurs when scarred liver tissue obstructs blood flow, increasing pressure. Peripheral edema, mainly in the legs and ankles, results from low albumin levels, a liver-produced protein that retains fluid in the bloodstream. These conditions can cause discomfort, infection risk, and mobility issues. Treatment includes managing liver disease, reducing salt, using diuretics, and possibly medical procedures to drain fluid or relieve pressure. Number 18, gastrointestinal bleeding. Gastrointestinal bleeding in liver disease is critical, often due to portal hypertension causing varices in the digestive tract to bleed. Symptoms include vomiting blood or passing black, tarry stools, signaling a need for urgent medical care. Treatment targets the bleed and underlying causes, potentially using endoscopy, medication, or surgery to manage portal hypertension and prevent complications. Prevention and early intervention. Taking care of your liver is a bit like looking after a precious garden. It involves a bunch of thoughtful steps and a good deal of TLC. Here's the lowdown on keeping your liver in tip-top shape. Moderation is key with alcohol. Downing too much booze is pretty rough on your liver. Keeping it to a minimum or skipping it altogether can seriously dial down the risk of nasty liver issues like fatty liver, alcoholic hepatitis, and cirrhosis. Eat smart. Picture your plate as a colorful palette of fruits, veggies, whole grains, lean meats, and good fats. This isn't just a feast for the eyes, it's a boon for your liver. Dodging heavy, high-calorie meals, saturated fats, and sugary stuff is crucial for steering clear of fatty liver disease and obesity, both of which are no friends to your liver. Get moving, lace up those sneakers and get your body moving. Staying active keeps your weight in check, fends off obesity, and keeps liver diseases at bay. Whether it's a brisk walk, a cycle ride, or a dance-off in your living room, aim for 150 minutes of moderate huffing and puffing or 75 minutes of going all out each week. Watch out for toxins. Some everyday products and pesticides are like kryptonite to your liver. When you're dealing with these bad boys, gear up with protective equipment and stick to safety guidelines. Medications. Handle with care. Always stick to the recommended doses for any meds, even the ones you grab off the shelf. Some of them can throw your liver for a loop if you're not careful. And mixing meds with alcohol? Stay clear of infections, getting vaccinated, practicing safe sex, and not sharing personal items like needles, razors, and toothbrushes can shield you from hepatitis viruses. Check-ins with your doctor. Regular visits to your healthcare provider can catch liver issues early on. If liver problems run in the family or if something feels off, don't hesitate to chat with your doctor. Taking these steps isn't just good for your liver, it's a solid investment in your overall well-being. Early medical intervention and regular checkups are crucial for maintaining liver health and preventing potential liver damage from progressing into more serious conditions. Here are several reasons highlighting their importance. Early detection. Regular checkups can lead to the early detection of liver issues before they become symptomatic. Many liver diseases, such as hepatitis and fatty liver disease, can be asymptomatic in their early stages. Early diagnosis allows for prompt treatment, which can halt or slow disease progression. Monitoring disease progression. For those already diagnosed with liver conditions, regular monitoring is essential to assess the effectiveness of treatment and to adjust it as necessary. This helps in managing the disease more effectively and preventing complications. Preventing complications. Early medical intervention can prevent complications associated with liver diseases, such as cirrhosis, liver failure, and liver cancer. By addressing liver issues early, you reduce the risk of these potentially life-threatening conditions. Lifestyle guidance. Regular interactions with healthcare providers offer an opportunity to receive personalized advice on lifestyle changes that can support liver health. This includes guidance on diet, exercise, alcohol consumption, and weight management. Vaccination and preventive measures. Checkups provide an opportunity to stay up to date with vaccinations, such as those for hepatitis A and B, which are crucial for preventing liver infections. Healthcare providers can also offer advice on how to avoid liver-damaging toxins and behaviors. Psychological support. Dealing with liver disease can be challenging, not only physically but also emotionally. Regular appointments allow for ongoing support from healthcare professionals, which can be invaluable in managing the psychological impact of chronic liver conditions. Comprehensive health evaluation. Checkups often involve evaluating other aspects of health that can affect the liver, such as diabetes and high cholesterol levels. Managing these conditions is vital for preventing further liver damage.